To the Max webinar with PDO Max. I'm so excited to have Bianca and Giovanna with us tonight. We are talking about building better skin, protocols with smooth threads, and skin boosters. Bianca, you've been on a Take It to the Max webinar before, but please introduce yourself and welcome.
Thank you. My name is Bianca, and I own a practice called the Luxe, and we're in Belmont, Massachusetts, which is about 10 to 15 minutes from Boston. And I use a ton of smooth threads and a lot of the skin boosters. I feel like it's a great combo. So I'm excited about this webinar because I'll get to share with you guys my tips and tricks.
Absolutely. Hi, Gio.
Hi, everyone. I agree with Bianca. I would have to say smooth threads are probably what made me fall in love with threads to begin with. And I find that they are so underutilized for the results that we get with zero to no complications. Same with the skin boosters. I brought the skin boosters to market because people weren't using the smooth threads in a way that I felt was um, it just amazes me that how little they're used for the results you get. And the skin boosters just make it a little easier to boost that skin. So it'll be a fun webinar to watch what Bianca's doing with them.
Absolutely. We will get into all of that, and we have some great videos. I'm Jacqueline. I am your host. I encourage anyone that is live to please put in some questions in the chat. We want to make this interactive. We want to hear from you. So tonight's agenda is the importance of skin quality and aesthetics, the role of smooth threads, a focus of PDO Afterglow and PDRN, our Glow Pin micro infuser, and just optimizing the skin quality with both and combo treatments. And Bianca's going to get into some really great tips and detail on that. So let's get started. Why does skin quality matter? Gio, I'm going to let you take this one. You talk about this as your core foundation in almost every webinar. And
well, it's 100% my core foundation. And what's really blowing my mind is how all of a sudden, if you've been scrolling through social media, it seems to be like all we're talking about. What's very bothersome to me is that's what we should have always been talking about. There is nothing worth doing if people's skin quality isn't maximized for their age. You don't look youthful without youthful skin. You can look lifted, doesn't mean you look youthful. So when I first started the company, I started it because I saw what threads did to skin quality. And it just matters because nothing else you do, whether it's filler, whether it's a facelift, whether it's internal biostimulation, if that epidermal layer doesn't look good, everything else you're doing, you're not going to be happy with. So it's been my holy grail since I was 16. The reason I got into skin care was to take care of skin. And it shifted over the last 12, 15 years to filling. Well, yeah, that's great. Contouring is important, all that is important. But we go back to it's that skin quality that makes the difference whether your patient is going to be happy with any of their other treatments. Would you agree, Bianca?
100% agree. I always say injectables are only as good as the envelope you put them in. So you could inject somebody's face with so many things. If they don't have the skin quality, it's never going to look right. So that's why it's always important to address both. So you can inject your biostimulators and your fillers and all of that. But if you're not using skincare, you're never going to get anywhere.
100% agree.
Great point. All right, next slide. Smooth threads, Bianca.
Okay, so smooth threads, we have blunt and we have sharp. So the blunt threads, we would need to make a small insertion site for, right? So we would use a needle to make that insertion site. But some of our smooth threads come already sharp and there's no need to make any insertion sites. And that's what makes them super easy and simple to use. So the point is they go into intradermal tissue to repair, tighten, wrinkled, crepey skin by replacing and adding collagen and elastin to damaged areas. So I always say to patients, they're like, but the threads are going to dissolve, they're going to go away. Well, the bonus is actually the collagen that you get to keep. So it's a reparative procedure. You do get some immediate tightening when the threads are there, but you do also get more tightening and collagen as your threads dissolve.
So Bianca, making a comparison to smooth threads and lifting threads, who is a great candidate for smooth threads specifically?
So everybody's a candidate for smooth threads because everybody needs collagen. Everybody can use some collagen. So I would say that's something that's universal. So everyone can use your smooth threads. Patients that you want to screen out for barbed threads are going to be the patients with thinner tissue. Okay. So those are the patients with thinner tissue. You will attempt to use a barbed thread, and those are the patients that you will end up seeing rippling. You'll feel the threads don't hold. They maybe they move. So a lot of times when threads get a bad rap, I would say they probably picked the wrong candidate. So a patient with a super thin face and thin tissue is not a great candidate for barbed threads, but they're an excellent candidate for smooth threads.
And I agree with that 100%. And if you get those really thin skin people, if you haven't done smooth threads and biostimulators to them, what are you lifting?
Yeah, exactly. Yeah.
A question just came in is how long does it take for you to see those results? And what is your treatment plan with, I know
Okay.
you get into it a little bit here,
Yeah.
but
So
maybe.
when you put the smooth threads in, besides like some swelling and bruising that may happen because they're sharp, you're going to see some difference right away. And then I usually tell people the noticeable swelling that they see is going to be gone around 2 weeks. Now, that doesn't mean the entire time their face is going to be really swollen, but you are going to have some swelling, and that small visual swelling they see is like about 2 weeks. I do think when they get to 4 weeks, patients usually say, actually, I think they look the best now. And that's usually when typically when all of the swelling is gone. So I say the 4 week mark is actually the mark when all the swelling has gone away. But for the patient visually, usually about 2. And when it comes to downtime, the downtime has to do mostly with the bruising. So if patients tend to bruise really easily, then they're going to have some downtime. For patients who don't bruise and or are really good at covering bruises, then it's going to be even less downtime for them.
And yeah, it's definitely patient specific and injector specific. If you're really good at keeping those babies superficial, there are times you get zero bruising. So it's really important to understand, if you're a provider, the depth and making sure that that tip of the needle doesn't dive down. That's really when you get your
Exactly.
bruising.
Yeah.
But
And
you're
oh, sorry.
you're sticking 20 to 50 needles in somebody's face.
Right.
I promise a bruise, and I'm God if they don't get one.
Right. I use a little bit of lidocaine with epinephrine, and I'll make little blebs just so that at least the insertion site there's less risk of bruising. That's something that can help. A lot of my patients have a red light that helps decrease bruising. Arnica, there's things that patients can do after the procedure to help speed up the process with the bruising.
Right,
And
next
I will agree with Bianca that 4 week mark is great. They really start. I know for the under eyes, it's usually that 2 month mark where people look in their rear view mirror and notice that their under eyes look better. For somebody who has, when you're talking about protocols, I tell people if somebody's skin is super thin, you're going to want to do minimum of 3 smooth thread treatments in a 6 month period, usually 2 months apart. That really helps that collagen boost to have those lifting threads hold. It's not that lifting threads are off the table, it's that you have to do some work before you lift.
Right. And so if I have a patient who's just going to do smooths and they're not going to do lifting, to Gio's point, I usually tell them to get the full result, you have to do 2 sessions. So I'll say we're going to do a round of smooths. I break mine up into small, medium, large, and extra large area. And so I'll say, say a patient wants a medium area, that's the most popular. I'm like, you're going to do a medium area of threads, and you're going to come back in 2 months and you repeat it. And then that's going to last you a decent amount of time. But typically I recommend at least twice a year for smooth threads.
All right, next slide.
So this is just a great shot because it shows the power of smooth threads. And I think that, to Gio's point earlier, smooth threads don't get enough attention, and they really could make serious changes in the skin. So when you think about correcting fine lines and wrinkles, and also treating the skin, they're a great option. So patients that come in and they're doing this, anytime someone's doing this, my first thought is like, how can we get them to do some threads? Because they're going to get the immediate tightening, but they're going to get the long-term benefit and repair of the collagen production.
Great, I love that photo. Next slide.
Okay, so this is a video and I'm not sure if it's going to play, but what I can do is just kind of talk to you guys about how I would use smooth threads. Okay, so cheek support. You can still use smooth threads in the cheek. So a lot of times we have patients that have fat pad breaks that come right down this way. That is a perfect spot for a multi-thread. And what our multi-threads are is it's more than one smooth thread on a cannula. And when we put them into the face, they kind of fan out this way, okay? And that is going to bridge that fat pad and provide support to the cheek. So this video is an example of a full face of smooth threads and how we can use them. Multi-threads can also be used in the nasolabial fold. So if we have patients that have those deeper folds, we know in the industry we've gotten away from filling those folds, but they do need support. Multi-thread is a perfect place for that. If a patient has a fine line, so it's not really something that's a deeper fold that we feel like needs to be filled, but there is that fine line and we want to repair that skin, we can use what's called a cyclone. And the cyclone is exactly what it sounds like. It's curled up this way. And when you remove the cannula and you leave the thread, that coil stays that way. And so it will fit perfectly in that fine line. It's also really great for the vermilion border of the lip. And also great for patients who may have had migration of their lip filler in the past. Putting that cyclone in the vermilion border can help repair that tissue and prevent your fillers from migrating and moving. And then along the jaw, what I usually use is our 29 by 50s. They're the pink ones if you're just looking visually. And I usually put those along the jaw. And then we have shorter threads, our 30 by 38s. I like to fan those out underneath the mouth. So a lot of patients, will do this and we'll see that they have some folding here, or you can visibly see that they have a jowl and their lip needs support. And we need to kind of create a smooth line and hide the shadows that we get from volume deficit and jowls. And so fanning out some 30 by 38 is a great way to do that. I also use smooth threads around the mouth. So it offers a lot of support around the mouth. So sometimes patients come in and they may be older and they're like, I want lip filler because I feel like my lip is disappearing. When you look around the mouth, there's so much structural support that's needed, but sometimes it's also a lot of volume because the skin has fallen. So that would be an area where you'd say, we can maybe do a little bit of filler, but we should probably put the structure and support back first with some smooth threads.
Agree. I do like the short multi-threads in the marionettes in a V, with half the thread in front of the marionette, half a thread behind the marionette, and it literally supports that marionette. Because a lot of times it's not even that it's lacking volume, it's lacking support. So it's falling in, but if you put filler, you get puffy. This just literally supports that marionette so that the muscles don't pull it down.
So it bridges the gap from here to here and creates like one smooth transition instead of having necessarily say this.
Exactly.
All right, let's play the video.
She has this fat pad break here, and we're going to use a multi-thread to fill that in and bridge that fat pad, and that's going to give her cheek a lift. We're also going to use a multi-thread in her fold. We can also use a cyclone here, which isn't typically where you'd use those, but for patients that have a really fine line as opposed to a deep fold, cyclone can work better there. This is going to be 29 by 50, and these are going to be the 30 by 38, and it's going to offer support under her mouth. So what it's going to do is pull this here, lift this here, and smooth this out here. So that's just the lidocaine with epi that I use to decrease the bruising. Also, it just makes it a little bit more comfortable for the patient. And again, multi-threads do require. So this is the multi-thread. So there's multiple smooth threads on one cannula.
And multi-threads, you definitely want to
You're just gonna
watch the
slide it
video on how to
straight
put
up.
those in,
And you paint
because
here.
they are definitely a technique-based
And
product.
you okay? Yes. You do
Mm-hmm.
kind
So
of want to normally be when in the we put fat in pad, smooth which is a little threads, we deeper. may, or even barbed
Mm-hmm.
threads, we may twist or twirl them. And with
So ours is
multi-threads, you
on.
don't want to do that. You want them to fan out nice and
Straight up.
even. So they're a little bit trickier to put in, definitely technique sensitive.
And you can see it kind of like lifts the cheek up. If you turn the patient this way, you can see the lift in the cheek as opposed to that side. And you can
we wanna
put
go to the
more
next
than
slide.
one multi-thread in
Doesn't
there.
look like our
As
video's
those
gonna
threads fan out
work.
here, it's gonna provide support to the mid
I
cheek.
can hear it.
And then if you look at the
Can't hear
nasolabial
it, it's
folds
not
You
now,
can hear it?
you can see
It's
how
going.
fine it is.
Oh, is it?
You
Okay.
can put
Yeah.
a multi there.
It's just
but it is
frozen on
fine
my
enough that
screen
You can
then.
also use a cyclone there if you really want to repair the fine line. So the next area we're gonna do is along the jawline. I always, again, I use a little bit of Lido with Epi, and I just use a really tiny BD syringe. Little blebs along the jawline. And then towards the back of the face, I use longer threads. So these are going to be like your 29 by 50s. And then towards the front of the face, when you get to this area, when there's, you know, smaller surface area to cover, you'll switch to like your 30 by 38s. And you do want to be like at a depth where you can see the thread moving through the skin. If you're deeper than that, it's not going to hurt the patient. You're probably in a fat pad, but you're not going to get as much support in the fat pad with these because they don't have the tensile strength that, like, say, a barbed thread would, than if you stay in the dermis. And sometimes when they get towards the top area, it can be a little bit pinchy, so just let the patient know that.
But as you can see, it's pretty well tolerated by the patient. It's not something that's super uncomfortable.
Yeah, she was comfortable the whole time. So that was about 4 weeks ago. How is she doing now? I can't wait to see her results.
She's doing great. I texted her a couple days after. I was like, I'm just checking in. She was like, oh, I'm doing fine. It was nothing. So she was really happy.
That's why I guess it amazes me that people don't use smooth threads like all the time, because it is pretty well tolerated and the results are pretty great, especially the second time you repeat them and you keep that collagen and elastin going.
They're really easy to
usually
use.
do
Patients are
at
always
least
happy.
5
The profit
along the
margin is
jawline.
great. I think with smooth threads, the toughest part for me in the
That
beginning
area
was
is
learning how to
pretty
price
numb
them.
at this point, so the
I have
folds
them
aren't too
priced by
bad. And
area, and we
also,
don't have to go over
because
that
there's
during the
plenty of
webinar,
Lido
but if
there, she
you have
won't bruise as
questions on
bad.
how to introduce them to their menu and how to price them, I can help you guys with that. And I combo the smooth threads with everything. So even if you're doing a little bit of filler, right? Filler doesn't fix skin laxity. So maybe you do a temple injection, you do piriform fossa, and then you do a little bit of cheek, and then you come in with your smooth threads to tighten up the lower
So
part of the
now she has
face.
plenty of lift and support
And I love them with
here,
laser.
and we
Anytime
just
you
need to
add
offer a
heat to
little bit
them,
more
it's
support to this
that
part
much
of her
better.
face.
People
It will
constantly
support her
ask
mouth.
me, well,
And
I
also,
heard you
even if
weren't
you can
supposed to
see
use
already just by
lasers with
lifting this,
smooth
how much
threads. And
wider
it's
her
like,
mouth looks here.
no, it's
So it
really,
provides
you
so much
want to
support
have
that
that
it turned this part of her lip
heat
back out
to
again.
make those threads kick in quicker.
Yeah. So I think in this
And I
last
do
part,
like
I'm
to
just
fan them
fanning
out
out
in
the
both
threads.
directions.
So this is an area when you're using fillers, higher risk for occlusion. So threads are definitely a safer option too, if that's something you're worried about.
We encourage anybody watching to ask away. Too. But in a couple questions, I'll get to them. All right, we'll go back to our slides. So go to the next slide. There's a couple more videos. And those listening live, we do have a wonderful promotion at the end of this webinar too. Let's dig a little bit deeper into cyclones versus multis and when to use them.
Okay, so I touched on this a little bit earlier, but the cyclone is exactly how it sounds. It's like a cyclone. It's like a twirl. Originally, we use those for the lip border. I think that's probably what Gio had in mind when she first created them, and they're beautiful for that. But I use those cyclones for all kinds of fine lines. So anywhere I see a really fine line on the face that I'm like, oh, I'd love to put some threads in there, get it to pop out, I'm going to use a cyclone. And then multis, I put places that need a little bit more support than say a cyclone would do. And those will fan out. You can put more than one multi in an area too as well. So I think in that video, I did 2 in each cheek, and you can even put 2 in each nasolabial fold if somebody's folds are deep enough.
I just did 4 under each eye.
Yeah. They're pretty awesome.
Yep, they sure are.
We have another video to show.
Hi, today we are discussing cyclones. There are 2 types, 2638 single cyclone and then the 2538 double cyclone. You can use these interchangeably depending on how much volume you want to add. Obviously the single has 1 thread, making it a little less volume adding, where the double has 2 threads, giving you a little more volume. I will show you how to use the cyclones. They are great for nasolabial folds, the 11s, anywhere you're looking for volumetric adding. They are needle, so no entry port needed. You will want to measure, here's the thread to the sponge. So I want the thread right in the nasolabial fold. So I will enter farther out because I need to be able to get the needle all the way into the hub. So I will enter farther out. I will slide it, and you can see how superficial I am. You can actually see the needle, and you will slide it all the way to there. That will be buried, but I just wanted to show you where to end. Make sure it's buried. Then push the sponge in, twist, and come out. Great other uses for cyclones are for the 11s. Same thing, you're going to want to measure where the thread is going to be. Her 11 would normally be from here to here, so we will enter out here. Again, keeping it superficial, just sliding it right under the skin. You can see my end point. Hold, twist, and come out. You can also use it, obviously it's hard for me to do this on my mold, but on clients who have a line right at the lateral canthus, you can place this right under that line. You can also use these anywhere you would use a smooth. So let's say you wanted to do a hashtag of smooths, but you want a little more volume to the skin, you would use these in the same way. So you'd be able to place them in the same areas you place smooth threads. So they can be used interchangeably with smooth threads.
I just thought of this as you were playing that video, but sometimes we have patients that have the skin laxity in the preauricular area, and it might be a little too thin to use a multi, but I will put a couple of cyclones in that area, and that helps to support the face as well.
Yep.
Another video.
My favorite threads. You can use multi-threads anywhere you need the feel of a solid filler. The 11s are another area you can use. Numb the insertion point with 0.25, 0.25 Lido with Epi. Go ahead and do your insertion just to the bevel. Doesn't have to be any deeper than that. Then take your cannula, same way you used it in nasolabial folds, just pop it in, flatten it out, and just slide it right under the skin. You want to see and feel the tip of your cannula as you are inserting it. And you can see, very superficial. You can see, I can see the tip of my cannula. Then just push the sponge in and slide it out. To use the multi-threads, let's say in a nasolabial fold, you will numb at the insertion point, and you will also numb at the piriform aperture. And the reason you numb there is because you will want to pop the cannula under that, and it gets a little spicy there. Then you will take your 18 gauge needle, just pop in to the bevel, remove your needle. The multi-thread is in a little L cannula. You'll be able to go right in. You will go in, flatten your cannula, and then you will feed it up the nasolabial fold, pop it under, the nares. You can pinch the skin to get it up there. Then when it's in, you want to hold firmly at the end, no twisting, and just slide the cannula out, making sure that that thread is completely buried. Our multi-thread cannula has 7 threads that are folded over. So when they are inserted, it's actually 14 threads that are under that area, basically creating a solid filler. For the temporal hollow, you will numb the insertion area with 0.25 with Lido with Epi. You will take your introducer just to the bevel because we are using an L-shaped cannula, so you need to introduce. Then you will take your cannula, you will pop in at that 70 degree and then flatten it right out. You are very subdermal, no vessels should be in your way. And you will just slide it in, hold at the end point, push the sponge up, and just slide it out. You will insert up to 3 in this area to really give that temporal hollowing some nice support. Again, flat cannula, and just use your other hand to just slide it in, and then push the sponge and come on out. What you want to make sure is that you're not seeing any threads at the insertion point. And one of the things I see when we're out in the field is people like yank the cannula out with multi-threads. Don't do that. You need to slide it out slowly so that that thread doesn't come back at you with the cannula.
Exactly. Okay, so now we're going to talk about glow pin, which is one of my favorites. So when we say glow pin, that's the device that we use to deliver the skin boosters. So it's 0.5 millimeters, and it's an airless pump syringe. It's super easy to use. And what this is going to do is just be a delivery tool for us to get our skin boosters into the skin with very little downtime and very little trauma to the skin. The stimulator, it can be done on a biweekly basis. So it is really gentle, even though it's really efficient, it is really gentle. So it can be done pretty often. So I'll just share quickly how I use this at my practice, because I think that that's what most people are looking for, is like, how do they actually bring this in and use it? So combo procedures are my favorite thing here. So I offer this as an add-on to injectable appointments and thread appointments. So if a patient was going to come in and they're like, I just want to do just that. Okay. So we combine it with a non-invasive radio frequency, and it's $549. If patients want to come in and they are having sculptor, or they're having filler, or they're having smooth threads, which is my favorite way to use it, or they're having tox, then we do it as an add-on. It takes 15 minutes and it's $250, and patients leave extremely happy. It decreases swelling. And so when you do procedures that cause swelling, like smooth threads or even barbed threads, it does help the patient feel better when they leave, because they're immediately looking better. Skin looks tighter, skin looks more hydrated. So the benefits of using the stamper, it's collagen induction therapy. We all know that phrase, but it's minimally invasive. It uses tiny needles to puncture the skin. And then as those little holes heal, it produces new collagen. And with the glow pin, we're also delivering the serums, which would be the PDO Afterglow and the Lume Envy. And I combine both of those serums when I do this procedure. And so, oh, sorry, go ahead.
Oh, I was going to say, my son last week posted that 50% of his appointments now add skin boosters to their,
Yeah,
the patients love it so much. It's
they love
not
it.
even that they add it, the patient adds it on as an
Yep.
add-on. They love skin boosters.
Once they try it once, they're going to be like, I want the same thing I had last time.
Yep.
So even if you're pricing it, say, as an add-on a little lower, the point is they're going to try it once and they're going to continually do it over time. And so you
Yep.
get your revenue back in the amount and quantity that they do, as opposed to just that one visit. And then the question of when to use it with the glow pin as a microinfuser, or to use it for microneedling. And so I use it for both. So I even use it for my RF microneedling. I use both of those serums, but the microinfuser is also what we use it for. We also use it for, we do collagen induction therapy. That's a little bit deeper than the 0.5. We can go up to a 0.1 with a different device. So think of this as a tool in your toolbox, not just something that has to be used with glow pin, not just something that, has to be used with just the way we're presenting it. You really can incorporate it a lot of different ways in your practice. And so when you're thinking about which tool to use, you want to think about what are the patient's goals and what does the next, say, week or so look like for them. Okay. So if they have a wedding next week, you're not going to use the skin pen, you're not going to micro needle them, right? But if they just want a quick glow and they need, we say the quick glow up here, then the micro infuser is going to be great for them, because there's going to be no downtime. They're going to look good right away. And they'll be able to maintain that look for a couple weeks. So if they have an event next week, it's great. Now, if they don't have those things going on and they're okay with some downtime, they have acne, scarring, deeper wrinkles, the serums are still going to help, but we may need a different tool to deliver them a little bit deeper. And that's when you use something like a skin pen that goes a little deeper and is a little bit more aggressive.
100% agree. I think if I was having a wedding in 2 weeks, I'd be going with the glow pen. One of the things I find with glow pen infusing is that they get no purging at all. I have yet to see a purge with a glow pen, where with your microneedler, they might, because you're going a little deeper, they might get a purge. So definitely want to look at their schedule of events. If they're a month out from something, go with the microneedler, because that'll give them that longer add-on. But if they're getting married in a week or two, but they just want to look glowy, glow pen all day long.
Yeah. And I think I mentioned earlier, I use this as combo procedure a lot. So I do the glow pin even over certain lasers. So I have a non-ablative laser. And so I will use the glow pin right on top of it after the laser. It decreases the swelling, it decreases the redness, and the skin is really absorbent after the laser anyway, so they can get even more benefit out of the product. So that's a great way to use it. I use glow pin on top of our low grade chemical peels. I mean, it's really versatile when you're using the microinfuser. You have a lot of leeway in how you can use it.
Well, and you can decide the day of. They may need that extra glow. They may need that help with the inflammation, along with the mask as well, which we did on your patient that was shown in the video before. Her skin looked completely different after you used the glow pin on her with the PDRN and PDO Afterglow combination. So they look really great after too.
It's great.
And that also is a benefit.
It's like immediate. It's an immediate reward, right? So as soon as they're finished, I like to vector the skin. I do hold the skin up pretty taut when I'm using the microinfuser, but you will see an immediate lift and glow, which is pretty cool, and patients love that.
And you really don't have to numb
You really
beforehand.
don't.
You know, you're deciding on the
It's
whim
really
and you're
light.
doing this. It's comfortable. That
Safe
0.5.
under the eye too. So it's
Yep.
great.
Yeah, as we were talking earlier, people are so hesitant now to do anything under the eye, but this is beautiful under the eye.
Yeah.
A question came in. So if you are doing this combination treatment, say you're just treating the face, from our standpoint, we typically recommend 1.5 ml of PDRN, 1.5 of Afterglow. How long does it last once you've opened it, and how are you storing it?
My gosh, I feel like I use it so much that I very rarely have like empty vials hanging around. If they're empty, I end up sneaking them and use them on myself. But they maintain pretty well. I mean, I do put them in the refrigerator, especially,
Mhm.
I'm not in the building all the time. So God forbid, like, the air conditioner shut off or something. But they store pretty well. I've had no issues with, say, one I used 2 days ago and I'm using it now. I mean, the effect doesn't seem any different.
Yeah,
They're
it's
pretty low
typically
maintenance.
to that
Yeah.
2-week period. And you're going to use it within that 2-week
Yeah, you're
period.
gonna use it. Once you get your patients on the routine of using it, you will
Mhm.
use it pretty quickly. It's not gonna sit for 3 weeks. It's
Nope.
just
Mhm.
And it really shouldn't. It's really something that almost every patient needs. It's the hydration that,
Right.
you know, we're outside, the sun, all the crap in the air nowadays. We're just
Mhm.
counteracting all your everyday dryness. I mean, I also use the daily Lumen V serum. I can't believe how well my skin stays hydrated just doing these treatments.
And I also think that's a good point you brought out the sun. This is a pretty much a summer safe treatment. It's not a deep depth, it's not aggressive, so you're not going to increase risk of hyperpigmentation with sun exposure. So if you have patients that don't want to necessarily do their lasers and their microneedling and their heavy peels over summer, but you'd like to keep them engaged and keep their skin looking good, this is
Mhm.
something that they can do a couple times during the summer to keep their skin looking good. And it's great for maintenance.
And especially if you're in the South where laser season is never,
Right.
it's
Right.
like this is, and you can, if you do it monthly, reverse the skin damage. There's no doubt that you will help the pigmentation. All the products were made to help with pigmentation.
I think one thing I really appreciate is the anti-inflammatory benefit
Yep.
of the products. And so I use them for a long time to keep rosacea flares under control. And rosacea is tricky. You can't be too aggressive with it. So the micro infuser was perfect for that because the serums are anti-inflammatory. It's not an aggressive treatment.
Mhm.
Yep.
Absolutely.
And that was a big part of when I was developing my boosters. I had a why of why I wanted to bring them to market. Everything that goes wrong with our skin is because of one reason: inflammation.
Yep.
Mhm.
Whether it's melasma, whether it's sun damage,
Oh, inflammation.
everything in our lives is inflammatory. So that was the main goal of especially in the Lumenvi, it's all
Mhm.
about anti-inflammation. So, like to your point, it's season proof. It's the
Yeah.
product you can use all the time and not have to worry if you go out in the sun 5 minutes later.
Mhm.
Right.
That's a great point. These are some other results with PDO Afterglow specifically and an RF laser treatment. And
Yeah, I love
skin.
that combo.
Yeah.
Yeah.
Next
We're,
slide.
this was just PDO. This was before we
Afterglow.
even brought Lumenvi out. PDO Glow, and we go back to what's PDO Glow. It's a non-cross-linked HA with a PDO powder. I brought it to market because of the complaints with the bruising with the threads. So I'm like, okay, how can I get the same product into their skin without bruising them?
Mhm.
Obviously, it doesn't go as deep as the smooth threads. So when people ask me, why do you pick one over the other? I don't. It's all about layering them. But
Mhm.
this result is just with PDO Glow.
It's amazing. Next slide. There's one more about it. Bianca, there's a question. What do you charge for Afterglow Lume MB when you're doing the combo treatment? Is there a difference, or is it sort of an umbrella under your skin booster? We get questions a lot about pricing, and I know it always ranges, but it's good to hear how the range
So
of pricing?
if it's an add-on, meaning the patient's adding it to an injectable appointment or say maybe a facial, they want to add it onto a facial, it's $250. If they're coming in specifically for just the glow pin, like that's all they want for the appointment, it's $549, but it includes non-invasive RF because that
Mhm.
service doesn't cost me actually anything. There's no consumable, but just
Mhm.
kind of like adds to the treatment. It adds value to the treatment, but it doesn't cost me anything. So if you have any devices like that, that's a great way to utilize them. So they get 10 minutes of non-invasive RF and then we do the glow pin on top of it. And patients are like ecstatic over it because immediately lift and tightened.
And also important to mention that PDRN and both with Lumenvi Skincare and PDO Afterglow do need some sort of channel. So that is the purpose of you needing to do at least that 0.5 depth to channel and deliver those specific ingredients in those boosters into the skin.
I mean, look at the pigment change in that
Yeah, it's
Yeah,
skin.
pretty
And
awesome.
again, just with PDO Glow.
just
Um, when
Afterglow.
we when we first started doing smooth threads, I'll never forget when we before when we were going through the FDA process and we had patients that came in for their treatments to go through the FDA process. We had a woman who was severely sun damaged, and we did a lot of smooth threads in her mid neck 3 times over 6 months. And then she came in the year later, and the middle of her neck looked amazing. We ended up having to do threads on the sides. So that just goes to show you just how smooth threads alone just help with pigmentation. And we go back to why, because even pigmentation is an inflammatory response.
Mhm.
So if we can bring down that inflammation, it's going to help all that.
Great.
And I think a great way to describe this to patients, because like, what is a skin booster? What does that mean? There's threads in a bottle. And I just
Mhm.
explain it like this to say, if I took a bunch of smooth threads and was able to melt them into a serum and put them into your skin instead of putting them in with a cannula, that's what it is. I
Yep.
feel like that's the simplest way to explain it to patients, and they usually get that. So say you have a patient who's afraid to do threads and they're like, I'm afraid to do threads. I don't want it to be bruised. This is a great option. It's almost like a gateway. Like they tried the serum. It's like if the serum works well, imagine how well
Well, yeah, a little
Mhm.
deeper, putting them in a little deeper. Yeah.
yeah.
It's a nice step to that, absolutely. And doing the combo treatment, you are able to get the benefit of the PDRN immediately, and then the progression of the result from the PDO Afterglow, because that does take time to start to hydrolyze. And that 3 week, 4 week mark is a wow factor. And this is one treatment 3 months later after just Afterglow. Look
It's
at that.
pretty awesome. I think I like here that it explains like the vial is 2 to 3 treatments. So you're getting a lot out of one vial. I mean, if let's say I'm charging, the 549 for the three treatments. I mean, that's a decent amount of money as compared to what it actually costs. So I
Mhm.
think with the way costs are rising for businesses, looking at things that have a larger ROI is really
Mhm.
where you're going to make up, that cost deficit
And
and
the
take
larger
those things.
ROI with actually getting results, because
Exactly.
we've all been in the industry long enough to call a spade a spade. There's a lot of products out there that claim to give results, and you do the treatment and 3 days later people look the same. What I love about these products is they each time you do them, the skin gets better and better and better. It's not that you're starting from square one.
Mhm.
It's the fact that you're improving and maintaining, improving and maintaining, improving and maintaining. And if you do these consistently, they'll look
Mhm.
better at the year mark than they did when they came into you.
Absolutely. And thinking back to the web chat that I did with Ryan about memberships and what he does is that added value, having multiple locations. He talked a lot about skin boosters being that added value to within that membership program because the cost is so low
So
compared to other
low.
treatments.
When we first brought, I talk about this all the time because my
Yeah.
son's he's not a cowboy. He's not a first adopter. He waits and sees, and he really waits to make sure that things do what they say they're going to do. And he was definitely not a first adopter of PDO Glow. He probably didn't adopt till 6 months in, and he brought it in for his membership. So he's like, okay, your girls are all talking about it. I see the results. This is going to be my freebie for the month for my membership. And, you know, he's my son. Nothing I do is right. It just is the way it is. And I'll never forget that he, you know, called me probably 2 or 3 weeks after he started adding it, PDO Glow on. We didn't even have Lume Envy at the time. And he goes, Mom, I just want you to know that every person I've done PDO Glow on, these are clients that get microneedling monthly. They're asking for PDO Glow specifically for their next microneedling. And that to me is, you know, we can say anything in marketing, right? We know some of the marketing claims out there are insane. It's when I hear things like that that I know we're in the right direction. It's when your clients are asking for a product that isn't national, you know, we don't have the funds to nationally market like some of these companies. When we're getting those kind of comments with, that's true marketing to me. I love to hear it from people like you, Bianca, who says, I use this all the time because A, it brings money to my business, which is like, first and foremost for me as a small business owner and for somebody who owns spas, right? I need to be able to pay my bills at the end of the month, not all my company's bills. It's like, we wanted to make it so that the practices could make money. And it is mind blowing to me with what some of these other skin boosters cost that may not even give the same results as ours. Ours are, it's geared for you to make money, plain and simple, and have your clients be happy. So I love when people love the product because I know it's making them money to boot.
Yeah.
Absolutely. That's a
And
great
it
point.
doesn't take long. It's like 15 minutes.
Right.
Absolutely.
And you know, having been in the skincare industry as long as I have, trust me, we've been around. Me and Jacqueline have been around a long time. We know the marketing gimmicks. We know the promises made out there. And when we bring something to market, I want it to work and I want it to be profitable for you.
Yeah. And look at this result. This is one treatment. I just have to keep saying that. This is 3 months later after one treatment.
Awesome.
So that actually, we just got a question, Gio. How often can you do PDO Afterglow? Tell us a little bit for both of you about a treatment plan with PDO Afterglow specifically. And then, of course, we're going to segue into Lume Envy and PDRN next.
Well, if you're using 1.5 to 1.5, you can do it monthly. If you're doing a straight PDO Glow, I would say do 3 months of PDO Glow and then go to every 3 months because it is a polymer. So the body needs time to get rid of it. So at the 3 ml mark, you're putting in quite a bit of PDO in there. So you want the body to absorb it and create its collagen. But if you're mixing it with PDRN monthly, PDRN, you can do monthly. That should just be part of everybody's monthly facial.
Yeah.
Absolutely. That's great. So 3 mLs would be one treatment area. So that could be face, and then other treatment areas would be your neck or décolleté area. And in the PDO Afterglow, the vial is a 10 ml. So you are getting 3 treatments out of that one vial. And Lume Envy is 3 mLs, and it's one vial typically per treatment area. So let's get into PDRN and Lume Envy next.
So I love this product specifically. I'm noticing for hyperpigmentation. It's doing amazing things for hyperpigmentation. I'm talking like one treatment, you're seeing a difference. In one area that I've really been using it a lot is under the eye, which is such a tough area to treat. Like you have to be so careful with that. So I'm combining it again, combination treatment. So I have procedure. It's called light eyes, and basically it is a combination of smooth threads, smooth under eye threads, and needling in some Lume Envy. And the results are amazing. So those dark circles under people's eye that they can't seem to get rid of, that they can't shake, this is perfect for. That's my favorite way to use this, but I do use it all over their face for hyperpigmentation.
Well, and you can see from the ingredients why you would have that. It's the PDRN is anti-inflammatory. The niacinamide feeds the skin. The HA, we know what that does, is hydrates. The glutathione, big deal in there. That is what is great for hyperpigmentation and vitamin C. So we really loaded this with the products that I knew would work on skin of color first and foremost, because obviously we wanted a product that would cross all skin types. But the skin of color is so under loved in the skincare world that it was very important to me that that was what we were focusing on, is every skin type. And this is a product that literally you can use on every skin type and you're going to get results. What it does for skin of color for me is pretty amazing. The brightness and the vitality it gives skin of color is beautiful. So you can imagine that on non-ethnic skin, it's just going to work even just as well. So it's just it's a beautiful product. I love it. And it's, everybody says to me, what are you bringing to market next? It's so hard. It really is so hard to come from this and go, okay, what else am I? It works. There's nothing else to say. It works on everybody. It works on redness and browns. So what else do we need to work on? It works even on, I wouldn't use it on cystic acne, because cystic acne, you really should go to a derm and get it handled. But it's going to even take care of inflammation in acne.
It does. It helps with staining. We've seen some really amazing before and after photos. If you follow on Instagram, we're seeing some really great results with, acne staining and that pigmentation from it. It's amazing what it's doing.
Yeah. And I mean, not that any of us ever want this to happen, but this would be a great product just to have on hand if you ever have someone that has a complication with, say, laser and has some hyperpigmentation, and you're like, "Ooh, that wasn't the desired effect." But as long as you have the tool to treat it, the patient's going to be okay with it. It's great for that too, because the results are pretty quick.
Absolutely.
And there are plenty of clinical trials out there that have been done, clinical studies that have been done. There's been clinical studies in burn units. There's been, it's just, and it's, PDRN is everywhere. There's a reason it's everywhere now, because it's one of the new products that have come out that show results.
Absolutely. A question came in: can PDO and Lume Envy be layered? Do you both recommend
just mix them? No need to layer.
Yep. I just put them all in the glow pen.
They were made to work synergistically.
Yeah. Yeah, and I think this slide is important because I think people think of PDRN as just, in the aesthetic industry, but if you actually look it up, if you just Google, peer-reviewed studies, PDRN comes up a lot. I mean, when I first researched PDRN, I read about how it healed, non-healing diabetic ulcers, right? So there's a lot of science behind it besides just us saying that it works.
Right. Next slide. It's a good story behind PDRN, Gio.
Yes. So, we see other PDRN companies out there in their farms farming their salmon. Ours isn't farm raised salmon. Ours is salmon that is in the waters, deep water, ocean waters. They are farming it or fishing it, and they use obviously the fish for food, and they then use the salmon sperm for this type of product. So we're not killing salmon just for the sake of getting their sperm. People are being fed with the salmon, and there's definitely a difference between the quality of farm raised versus deep ocean raised. It's no different than what you'd want to eat. I mean, I don't eat farm raised fish. I definitely wouldn't be injecting it.
I get this question a lot, actually. People are like, are they harvesting the salmon just for their sperm?
Right.
Like,
no. No, you probably ate the salmon last night that we're using the sperm on your face today.
Yeah, no, that would be terrible.
Next slide.
Okay, so we kind of went over this a little bit already, but I do stamp right over smooth threads. I stamp right over barbed threads. I do barbed threads and smooth threads in the same session, and I stamp right over that. I mean, I use this stamper so many places in my practice. And if you look in this video, I don't have the full air pump, but I'm just using a syringe with, my little micro injector, and it works amazing. And it's going to immediately bring down the swelling, which I think is really helpful, because when patients leave, they're not concerned that their face is swollen.
And I have to say, I use it on myself post any type of ablative laser. I'm a
Yeah.
sweller. I get huge I'm a histamine reactor. And I have found that since we've been adding the PDRN to my regimen, I don't swell at all. And I'm barely pink the next day.
That's
And if you
beautiful.
look at Bianca's client, she's pink. There's no blood. We don't draw blood with this. We just get them to a nice pink, healthy glow. We know at that point they've gotten a good treatment.
Mm-hmm.
It is crazy to me when I watch the videos of microneedling where people are bloody, and it's like it was never meant to be that way.
Right.
It's meant to. You're not. I guess I'm tired of the over inflammation that's going on in the industry of the skin. I'm all about combo treatments as long as we're not melting their fat layers.
Yeah, people are like attacking skin.
Oh my
I
God,
don't think
it's
Right.
it's supposed to
insane
attack
to
it.
me.
That's not going to work.
It's not going to
No.
work. If anything, you're going to cause true fibrosis.
Yeah.
And I think that's where when, plastic surgeons talk about all this fibrosis, I really think it's coming from the over
It's coming from
aggressiveness
aggressive treatment. Yeah.
Mm-hmm.
of what was
Mm-hmm.
going on in the industry there for a while. I mean, I'm all for stacking lasers, but you know what? If I'm going to stack a laser, I'm not going to do it on the high end for all three
Right.
treatments, right? It's like we need to back off a little. I think that we're seeing a lot of skin atrophy because of how aggressive we've become.
Yeah, we're seeing a lot of fallout from that, and it's making people nervous about procedures. So
Yep,
this is a good.
Well, and
yep,
Gio, you always talk about you only needed at 0.5 depth for that PDRN to work, for that, PDO powder to
exactly.
work. So it's
It's
0.5.
all about stimulating turnover,
Mm-hmm.
not killing the skin.
Right.
It's we went from stimulating turnover to like wanting to ablate 10 layers of skin.
Right.
I don't know where we lost that, you know,
Back.
understanding that overdoing it is overdoing it.
Right.
I
Mm-hmm.
mean, unless somebody has deep acne scars, nobody should be going that deep.
Yeah. Yeah.
No, there's really not a
No,
need.
absolutely.
And I think a lot of times people do that because patients are like, I want a one and done treatment. There's
Mm-hmm.
never a one and done treatment. It's not going to work. You're going to get the most benefit out of the things you do most often. It's like exercise. If you only exercise once a year, it's not going to do anything for you.
Yeah. Yeah.
You know, if it's something you do on a regular basis, that's where you get something
Mm-hmm.
out of it. So I do advise my patients, like sometimes, a less aggressive treatment done more often is going to get you more of a result than something
100%.
super aggressive that you can only do sometimes.
Well, and it spins back to the skin quality. So
Right.
we're going to get to it, but what are they using at home? That
Right.
is half the battle there. That's very
Again, like
important.
consistency. So what
Mhm.
you use every day is going to get you always, the most result, which is
Getting
where
that
at-home skincare comes in.
absolutely. Gio, this is your protocol map for smooth threads.
So, yeah, under eyes, obviously, like Bianca said, you no one's doing much filler under the eyes, and there's a reason. Smooth threads under the eyes are beautiful. Smooth threads in the cheek hollows, in the jawline. We don't have it there, but also um, chin shadows, great. Glabella, beautiful. If they're super deep, I go in with multis. Um,
I do always suggest, especially just a point we talked about, like the 2 sessions. So for under eyes, I'm always like, it has to be 2 sessions
it
because
has to
sometimes
be.
there's only so many threads you can actually get in that small area before they start to get puffy and bruised. It's a sensitive area. The threads are blunt, so that's why they're under eye threads, so less likely to cause bruising, but it's definitely an area that needs, 2 sessions for smooth threads.
Yeah, but glabella, I tend to use either cyclones. If I'm just preventative, it's smooth. If it's corrective, it's cyclones. If it's corrective plus, then it's multis. But then you do the boosters over all this, and
It's
it's
awesome.
beautiful. What we have found is we have a lot of people that tell us they stopped doing PRP microneedling once
Yeah.
they started using PDO Glow and Lume Envy because the results were as good and longer lasting. So they're saving the time of drawing the blood up and all that. So if you're using smooth threads and boosters, you don't need to microneedle and PRP.
No.
This is a great synergy right here, from your threads to PDO Afterglow, Lumenv, and Glowpin. It's all right
Yep.
there. And finish with the Lumenv sheet mask as well. The glass
Exactly.
sheet mask that has plant exosomes and PDRN. It's perfection and very cooling too. That's always the feedback as well.
And that's also just something, patients love sheet masks. They love
Yes.
like treatments they can do at home. So that's
Yep.
just a great retail item that you can have. Keep them up at the front desk, and people are going to pick them up when they're standing there, and they're like, I'll take one of these. Passive
And
income.
yeah, and they're so reasonably priced. Again, we try to make our price points for the average consumer, not just the wealthy consumer. That's important to me. I'm glad that people have a lot of money and can do this all the time, but not everybody can. So we've tried to make price points that are fair to the consumer.
Great. Before we move on from this, another question came in to talk a bit more about treating the jowl area.
Okay,
You
so
want to take that?
the jowl area. So always, we're looking at jowls and we're thinking like, why are we having jowls, right? So you're not just looking at the jowl, you're probably going to look at the back of the face. You're probably going to look at what's above it and what's around it. And so if somebody has really heavy jowls, I could put as many multis here as I want and as many smooths, and I could fan, and I might not get enough support. So I have to go and support the other areas of the face, right? So if I have heavy jowls, I'm definitely going to treat a little bit in the preauricular area, in the jaw, in the around the gonial angle. That's going to offer some support to lighten up the heaviness here. And then I'll go in to bridge the gap with some more smooth thread. So depending on the size of, how heavy the nasolabial folds is going to affect how you treat it.
Great. Thank you. All right, we'll move on to the next slide. We're a few moments left, few slides left. And we'll talk about one of the newest additions to PDO Max, Lumenv, the Glow Between Kit. Gio, you want to share a bit about it and your passion behind it?
2 years ago, while we were brainstorming what next, right? What we started seeing, obviously, is the economy changing and people not being able to afford to go to the spa as often. This is not to replace a spa treatment at all. It is to maintain what was done to them, especially if they're pushing out their appointments 2 to 3 months. I survived the 2008 spa crash. So it gave me some insight to what people will keep spending money on and what they won't keep spending money on. They will keep spending money on themselves, just not as often. So what happened back in 2008, because I owned a spa, I owned a hair salon, people would push out their color appointments. So what became really big? The wow powder, right? To be able to spread out their appointment, because clients want to keep coming to us, but if they can't afford us, they're going to do something in between. So that is why we brought out the Lumenv Glow Between Kit. It is literally to prevent your patient from backsliding on the work you've done. And it's to maintain it. So next time they come in, they don't have to start from square one. So it's got, the Lumenv serum, which if you haven't used, you should try, because for me, it's a one and done. It's the only thing I use in the morning, because it's got all the same things the Lumenv does, plus more. It has the microneedle, the stamper at a point, I think at 0.25, 0.3. It's minimal, what they can use at home. And it's got the mask. So it gives them a spa treatment at home to help maintain what they just spent hundreds of dollars in your clinic. And it's only right to have them be able to do something in between, especially the ones that, the price of gas is going up, the price of housing is going up, everything's going up. They're not going to give up their services, and they're going to stick with you loyalty wise if you help them transition each month.
Yeah. And I think in general, home skincare is really important. They're never going to be happy with their in-office treatment if they don't have a treatment plan at home, because every time they come in, it's going to be like starting fresh, and they're going to feel like they're wasting their money.
Their money.
They're going to be like, I'm paying hundreds of dollars and I look the same. It's because you're doing, it's what you do every day that's going to get you the most benefit. And so I think in the past too, when it comes to the economy and how people spend on themselves, it was the routine to have like a 10 product routine that you layer on, and nobody has the funds or the time and patience for that anymore. So I always say, like, you're going to pick 1 or 2 products and you're going to stick to those, and they're going to be products that, you know, other lines don't really make. So there's a million different lines, right? But every line has like one, you know, product that actually does, that's unique to them and actually does what it says it's going to do. So this is a great example of that product. Like, it's going to do a lot of things for you. One product is going to do a lot of things for you, and there isn't a lot available on the market like it. So it is a unique product that's worth spending your money on, that's going to get you what you need.
Absolutely.
And that's exactly it, Bianca. You nailed it on the head. Because of course, obviously, when we brought this out, people were like, "You're competing with." No, we're not. That's the whole point. The whole point is we don't want to compete. We want to have that bridge of the stuff we're selling to you to make them look good and feel good, but be able to maintain that at home without it costing them a fortune. I mean, I use retinol at night and I use my Lume Envy in the morning, and we go back to back in the day, 20 years ago, plastic surgeons once said to me, "What would be if you were to do a skincare line? What would it be?" And I said, "Vitamin C, retinol, niacinamide, glutathione. Done. End of discussion." Everything else, it's like I look at some of these lines with 20 products in them, and I'm like, ugh,
It's
like
overwhelming.
like
Right. It is overwhelming.
it's overwhelming, right?
Mhm.
And I don't have the patience to wait for 20 things to dry before I put my sunscreen on.
Right.
This is a very minimalist way to get there, and using those ingredients that you used in clinic. So it all works in synergy together. What's in the glow pen is not what you use in clinic either. I think that's important to talk
Important.
about.
Yeah.
Is there's
You share
vitamin
that with
B,
patients. It's not
there's
replacing what they do in office. It's complementing it.
exactly,
It complements.
exactly. It's a smaller percentage of PDRN, but it has that PDRN. It has the vitamin B in it. It has those nutrients in it. And this will last you that 6-week period as you're staggering your masks every 7 to 10 days or so and doing that Lume Glass Skin Serum daily.
Yep.
So thank you everyone
Thank you,
that
Bianca.
has joined. Thank you, Bianca. Thank you, Gio. Thanks for all of the great questions. We are offering this as a replay, and for the live webinar special through Monday, May 25th, you will receive 25% off Pure Brilliance bundle package. That is a combination package for you to set you up for success with in-clinic, everything Bianca talked about today, Glow Pin, PDO Afterglow, and Lume Envy. The ROI on this is huge. And if you do your memberships, this is a great way to plug in for the Pure Brilliance bundle package, and 15% off Smooth Thread, since that was the main topic for today as well. So
Yeah.
thank you, everyone.
Thank you, everybody. Bye,
And if you
Bianca.
guys have questions that didn't get answered, I love to teach and I'm not a gatekeeper. So I'll tell you anything you need to know. You can just message me on Instagram and I'll get back to you guys.
Awesome,
Thank you,
Bianca.
Bianca. Same
Thank
thing for
you.
us. We're here to support you
Bye.
and set everybody up for success. Bye.
Bye.
Bye.